Hi, my name is Claudia Fotiu, and this is part 1 of my fitness assessment and exercise prescription presentation for KIN 557. All right, so we're gonna go ahead and obtain some baseline biometrics from our subject. That's gonna include a resting heart rate. We're gonna auscultate using our stethoscope the systolic and diastolic blood pressure at resting. We're also gonna use our measuring tape to obtain hip to waist ratio, as well as our skin fold calipers so we can perform a skin fold test on our subject. All right, so we have our subject here, and the first baseline biometric we're gonna go ahead and obtain via palpation of the radial pulse will be their resting heart rate. And the way we're gonna obtain this is we're gonna have them go ahead and just supinate that forearm. We're gonna identify the radial pulse via palpation, right? It's usually just gonna be proximal to that thenar eminence. And we're gonna go ahead and count that for 30 seconds. We've got our timer, and what we'll do to obtain beats per minute is we're gonna go ahead and obtain it for 30 seconds, and we'll multiply it times 2. All right, so we're gonna get started. We're gonna make sure we've identified that radial pulse. Okay, once we've got it, we'll start our timer. Okay, perfect. Okay. We got 80 beats per minute for that 30 seconds. All right, so the next baseline biometric we're gonna go ahead and obtain from our subject is gonna be their resting blood pressure. So using a sphygmomanometer, which is gonna be this blood pressure cuff, with our stethoscope, we're gonna go ahead and auscultate both diastolic and systolic blood pressures. For our systolic blood pressure reading, we're gonna try to appreciate the force with which blood is being exerted through vasculature, and then the diastolic blood pressure is the force being experienced while the heart is refilling between beats. So what we'll go ahead and have them do, you want to ensure that their legs are uncrossed, so if you don't mind uncrossing your legs. Once again, we'll have them supinate the wrists, and they can rest the back of the hand just on their thigh. That's perfect. Do you mind if I roll up your sleeve?
Sure.
Okay. So we're going to go ahead and roll up the sleeve. Okay. We'll place our cuff. Make sure you're conscientious of where the balloon is. Make sure that balloon is ensured it's in the right positioning. All right, we want to be able to occlude that brachial artery. So I'm going to work around you here. Okay. Now you'll apply a little bit of pressure. Right. And again, you want to adjust the balloon so it's placing occlusion on the right part of the body. All right. If this flap is excessive, you can always kind of just push it back a little bit. Make sure it's all lined up well. Firmly apply that. Now you have access to the meter. Again, nice and relaxed. That's perfect. Got your ears in. Okay. You want to ensure that you have this to the adult size, not the pediatric, and you can test that via auscultation. You want your ears facing forward, all right? And you'll be able to appreciate the difference. This is going to be the pediatric. It's going to be a little more muffled. You switch that to the adult, and you'll be able to appreciate the difference. So what we'll do is we're going to want to palpate that brachial artery by the antecubital fossa, okay? So you want to make sure you palpate that, okay? Once you have palpated that pulse point, go ahead and replace your fingers with the diaphragm or the bell of the stethoscope. Just like so. You want to make sure you have good application, right? Nice firm grip. You don't want to be picking up any artifact, right? Any of the tubing running into each other or anything like that. Right, based on their size, average height, average weight, I would say, we're going to go ahead and pump this up to 180 systolic to start. Okay, for your larger patients, you may want to pump that systolic or that meter all the way up to 200, depending on their size. But for you, I'd say 180 is more than enough. Turn that dial all the way to the right, and we're just going to go ahead and pump up. Okay, to 180. When I get to that 180, I like to hold it for a second, really nail down that artery, and then I'm going to go ahead and release this dial at the rate of a second clock, on a second hand on an analog clock. Okay. So for systolic and diastolic, we have 108/60. That's a nice blood pressure. Okay. Again, when you're using this type of blood pressure cuff, your readings are always going to be in even numbers. So your digital ones might have odd ones, but when you're using this, the sphygmomanometer, you're going to always have even numbers. Okay, so all right, so the next set of biometrics that we're going to go ahead and obtain from our subject is going to be the Jackson-Pollock's 3-site skin fold test. So the 3 points that we're going to go ahead and obtain these measurements will be the tricep, we'll also do abdominal, and then suprailiac. And the reason we're going to go ahead and omit the thigh right now is just because of the material that they're wearing, and also you want to make sure you're conscientious of your subject's comfort. So we're going to go ahead and work with tricep, suprailiac, and abdominal. So to start, we'll go ahead and get our tools. So I've got the measuring tape that we're going to go ahead and use, and the first one we'll obtain, we're always going to try to obtain these from the right side, is the tricep. So if you don't mind turning towards that wall, that's perfect. So our anatomical landmarks that we're going to want to do is the acromion process and the olecranon process. So if you don't mind, I'm going to have you just slightly bend that left elbow, that right elbow. Okay, we're going to use centimeters. We're going to use our measuring tape. Do you mind if I roll your sleeve up? Sure. Okay. So just going to kind of roll that up. Make sure you can identify, palpate that acromion process. This is going to be one of the anatomical landmarks we use to measure this. So from the acromion, nice and firm, all the way to the olecranon, we're at 39. Oh, thank you very much. We're at 39. Okay, so what you want to do is you want to chop that in half. So it's 39 divided by 2, about 19.5. So what you can do is you're going to hold that nice and taut, right? And with the pen, we've got about 19.5. Okay, that's going to be our halfway mark. So what we'll do to ensure that we're getting posterior tricep, we're going to go ahead, and I'll take that if you don't mind. Thank you. We can use this. Ensure that it's nice and level. Right, you want to make sure it's not slacked or falling down. And we'll get right to the posterior tricep, right about here. Okay, so same line. And what we'll do is we're going to have, this is our pinch site, and then 1 centimeter below is where we'll introduce the calipers. Okay, so I'm going to go right here from the back of you to 1 centimeter below. That's usually just less than half an inch. 1 centimeter below. Okay. There we go. Okay, we're going to hold that. What I'll go ahead and do now is I'm going to go ahead and do my skin fold. About 2-3 inches of skin, making sure you're separating that subcutaneous tissue from muscle or bone. We're going to place our calipers inferior to that, about 1 centimeter below. Okay. Going to hold, give it a second to get a nice grip. Okay, gently releasing, maintaining that pressure. Okay, good. And we're just at 17.5 for the tricep. Okay. Okay, and typically you want to take 2 measurements of this. So what we're going to go ahead and do now is we're going to work on the abdomen, if you don't mind. So we'll have them face anteriorly, and we'll go ahead and get our measurements for the abdomen. Okay, so if you don't mind, you want to ensure that they have their arms down by their side. So if you're comfortable, if you don't mind putting yourself into your sports bra, is that okay? Just to ensure. Of course, you want to obtain consent from your patients to make sure that they're comfortable with, as you obtain these metrics. Okay, perfect. So what we're going to do, again, we're going to be using centimeters. We're going to identify the navel right on the midline of the body, and we're going to go 2 centimeters lateral to that, to the right. We're going to obtain these on the right side of our subject. Okay, I should always be prepared and have my pen ready. Okay, here's the lateral aspect of the navel. There you go. Sure, thank you very much, right? 2 centimeters is going to be just about here. Okay, now from this landmark, we're going to go inferior to that, 1 centimeter. Okay, thank you. Well, you want to just add not too much of the skin, just there you go, nice and flush. Okay, that's perfect. Thank you very much. So we've got our landmarks, we've got our point for pinching, and then we're going to go ahead and introduce the calipers. So same thing, about 2-3 inch hold, separating that tissue, that subcutaneous tissue, that layer from muscle. Okay, and then we'll introduce them. This is going to be a vertical pinch, so we're going to introduce these. Alright, just about here, just inferior. Okay, same grip. Hold that for a second. Make sure you have this exactly perpendicular. Okay, very good. So this is going to be 16. Okay, so we're at 16. Alright, and again, really important to make sure that you aren't dropping this caliper or having it super angled. It should be level with that skin fold. The next one we're going to do, the last one, we're going to do suprailiac. So usually following anatomical landmarks, we can follow the iliac crest. And again, this point where we're going to place our marker is not necessarily going to be mid-axillary, but it's going to be anterior axillary line. So from the anterior axillary line to that iliac crest, or that anterior superior iliac crest as well, you can use those anatomical landmarks. You're going to palpate for that iliac crest, right? Are you ticklish? Sorry. We're going to palpate, just make sure we have on the iliac crest itself, and then you're looking at that anterior axial line. Remember, not mid-axillary. We're going to come forward just a little bit, right? Just lateral to the breast tissue. Just right down here, okay? And we can actually go ahead and grab our calipers from here. Remember, we're going to go ahead and do a nice little pinch, kind of a transverse pinch, if you will, right? Using my right hand to obtain my measurement, okay? Again, we're looking at about 1 centimeter below, okay? So just from there, use my reach. Okay, we're going to hold, making sure that's perfectly level and perpendicular. Make sure we've got a good grip before we let go, okay? Very, very good. Okay, and that's at 12, then release that. Make sure you're not pulling away when it's still attached to your subject. Okay, and that's 12. And usually you want to emphasize, you want to take at least 2 readings of this, all right, per site. Thank you very much. Thank you. Okay, so the next one we're going to go ahead and do is their waist to hip ratio using a tape measure as well. What we want to do is from the xiphoid process, so just inferior to the body of the sternum and the navel at midpoint, the most narrow point of the torso. So I'll have you do is we've got our tape measure. So, do you mind if I reach across your body? Sure. Okay, excuse my reach. All right, you want to get the most narrow point possible. And again, you want a little bit of overlap on your stuff here. Okay. Go ahead and take a nice deep breath. Good, and you're gonna let it out nice and relaxed. Okay, following that relaxation. Okay. We are actually right here at 28.75. Okay, so I'm gonna go ahead and document that. We have 28.75 at the waist, and then for the hip, do you mind if I reach across your buttock? Okay, we'll go ahead, we're gonna take the measure, and how we'll do this is at the widest point of the hips, right by that retrocanter usually is a good anatomical landmark, okay, and just around the gluteal fold, just superior to that gluteal fold. Excuse my reach. We're going to the widest point of the hips, okay. Very good, feet nice and together, very, very good. Okay, excuse my reach. A little upside down here, that's okay. Okay, we're right on 39.5, okay, so 39.5. And what we can do for that is you can go ahead and calculate that. So how we would calculate it is we would divide the waist by the hip to get our our waist to hip ratio. All right, thank you very much. Sure. So we're gonna go ahead and obtain our goniometric measurements using a goniometer to assess range of motion. The range of motions we're gonna go ahead and obtain are gonna be shoulder range of motion. We'll do elbow range of motion, hip range of motion, and then knee range of motion. So we're gonna go ahead and assess flexion extension of the shoulder. So it's important to understand where to place your goniometer. We've got a movement arm, an arm that moves. We have our axis of rotation, and then we have a stationary arm. So this is gonna be important that you're maintaining placement, consistent placement every time. So with this, with shoulder flexion, you can have them laying down or standing, either or. So for the seated position, I'll actually have you have the hand right by your side. Make sure they're clear of the table. So with this, your stationary arm is going to be perpendicular, not perpendicular, parallel to the trunk essentially. That axis of rotation should be the lateral aspect of the humeral head. And for this, where this center line is, our anatomical landmark we're going to use is going to be that lateral epicondyle of the elbow, or the humerus I should say. All right, so whenever you're ready, we're going to go ahead and hold this here, okay? So again, this should be with the trunk, so it's going to get a little tough. Your axis of rotation is what you're going to want to pay attention to. Make sure that is lateral to that humeral head. So what we're going to go ahead and do, we're going to keep this all nice and centered. Okay, make sure this portion is just right on that lateral epicondyle, which you can palpate. And then have you slowly begin to come up, nice and slowly. Good, keeping this nice and still all the way up. Hold on 1 second. Okay, keep going, all the way up to the top. Hold on 1 sec. Okay, now we've got this flush, and make sure that's still stationary. You've got the radial head all the way up to the top. Keep going, all the way, deep down as far as you can comfortably. Okay, good. All good? Okay, this is exactly at 180 degrees shoulder flexion. Okay, so what we're gonna go ahead and have you do is bring you all the way back. Okay, maintaining that axis of rotation, that stationary arm with that thumb up. Okay, so we're gonna write that down. I have 180 degrees of shoulder flexion. And for extension, it's gonna be the same thing. Keeping an eye on that axis of rotation the whole time. Okay, again, lateral epicondyle, and let's go ahead and have you extend as far as you can. Oops, go ahead and keep going, keep going. Good, keep an eye on that thumb. Okay, good. All right, and this is gonna go ahead and place us at just 70 degrees, okay? So 70 degrees. Okay, keep an eye, you don't want superior excursion of the shoulder, okay? Same thing with flexion, you don't want to start seeing extension of the back. Very good, so we're gonna go ahead and do the elbow next. For the elbow, again, you wanna make sure you've got your anatomical landmarks and that your stationary arm and axis of rotation are gonna be stationary, essentially. So with the elbow, I'm gonna go ahead and have you actually fully extend the elbow to begin with. Axis of rotation is gonna be on that lateral epicondyle, okay? You palpate that lateral epicondyle. This is your axis of rotation. This is where your stationary arm is going to be. It's going to be parallel to that humeral, that lateral longitudinal line of the humerus. Okay. Again, we're going to go ahead and actually I'm going to have you supinate the forearm. Go ahead and perfectly straighten that out if you will. Is that the farthest you can go?
Yes.
Okay, good. And we've just obtained our extension in that moment, which is perfectly zero. Okay. So with that, we've got everything all set. This is going to be a long parallel to the radius, okay? You want to make sure you're going to be out of the way effectively when they're performing the motion. Let's go ahead and we're going to have you flex that elbow as much as you can. Good, keep going, keep going, keep going. Very good, okay? So here we're just at about 146 degrees flexion of the elbow. Okay, and we had 0 degrees extension. Okay, that's perfect. So the next thing we're going to go ahead and do is we're going to do the hip. So if you don't mind, I'm going to have you lay supine. Okay? So we'll have your feet over here. Very good. Okay, perfect. And you're going to go ahead and do supine. I'm going to try to be out of the way so you can see this as well. Again, we've got our anatomical landmarks. Stationary arm can be parallel with the trunk. This axis, we have a lot of, you have to overcome clothing, musculature, things like that. So usually the greater trochanter is a very good anatomical landmark to keep this axis of rotation. And what helps with the table, we could also have done this with the shoulder, right? By keeping this level. But for the hip, we can actually use this to keep this level. And usually I'll measure along the greater trochanter. All right? And so what we'll do is this movement arm is gonna be along that longitudinal axis of the femur. All right, so let's go ahead. We've got this nice and stationary, right? You can palpate that greater trochanter. Usually I always say it's right where your pocket are, just usually inferior to the pocket. Okay, and it just helps. We're on a table on a firm surface, so just keeping this level actually. So let's go ahead and keep this with the longitudinal axis of the femur. All right, what I'm gonna have you do is you're just gonna naturally, with a straight knee, you're gonna lift. So we're looking at active range of motion. You're gonna go ahead and lift the leg up as much as you can, okay? Here we go. Okay, whenever you're ready. Okay, and this has us at just about 82. Okay, so we've got 82 degrees. Okay, what we can have you do actually, if you roll over onto your stomach, all right, and we'll do the same side here. Okay, we will take the same measurements, right? We're gonna have the stationary arm parallel to the trunk, okay? It's actually, if you don't mind lying flat, so you'll have your arms by your side. That's perfect. I'm gonna squeeze in here if you don't mind, okay? Yep, you can perfectly. Keeping this nice and level, okay? So we're measuring the same leg, which is why I'm on this side of the body. Keeping the stationary arm parallel to the trunk, we can use that greater trochanter as kind of our axis of rotation, keeping this flush against the skin, keeping this that moving arm parallel to that longitudinal axis of that femur. And what we're gonna go ahead and have you do, if you don't mind, you're gonna, with the knee straight, you're just gonna try to lift the thigh as far off the table as you can. Okay, right about there. Okay, good, perfect. All right, so that has us at about 31 degrees. Okay, so 31 degrees. So we have 18 degrees of flexion in the hip with 31 degrees of extension. And again, you want to look for compensatory movements like kind of leaning into that right hip. Those are things we want to look out for. The last one we're going to go ahead and do, if you don't mind, is I'm going to have you lay supine again, which will be on your back. And we're going to check your knee range of motion. Okay, and we'll keep it to the left side. All right, that's perfect. So with this, once again, we're going to use our anatomical landmarks. For this one, stationary arm at this point is going to be along, perfect, the femur. Okay, this axis of rotation, you can kind of palpate that knee, that femoral condyle. That's where your axis of rotation is going to be. And then your movement arm will be moving parallel to that lateral aspect of that fibula. So we're going to try to keep this level. Luckily, we've got the table, which helps us out if we're on a sturdy surface. Okay, holding this firmly. All right, making that nice and level. And what I'm going to have you do, if you don't mind, I'm going to grab your thigh. Okay, we're going to keep this along the lateral aspect. All right, you're going to hold that nice and firm, lateral aspect of the fibula. Ideally, you can line it up with that lateral malleolus. Okay, so same thing, keeping this nice level. Whenever you're ready, you're going to go ahead and bend your left knee. Okay, very good, very good. Keep going. Okay, good, good, good. We want that nice and flat. Okay, so this puts us at about 134 degrees of flexion. Okay, 134 degrees of flexion. And again, let's have you nice and relaxed again. Okay, I want you to try to push that thigh, the back of your knee, flat on the table as best you can. Okay. Again, same thing, line up that lateral malleolus. And actually here, if you're keeping it really, really firm, we're at about 1, where you have 1 degree of extension. Okay, very, very tiny amount. You're not going to be able to appreciate a lot of extension in the knee or the elbow, although with female subjects, you might experience some or appreciate a little bit more laxity in the joints. So you might get a little bit of extension in the joints that you might not otherwise appreciate in your male subjects, which depends. Again, you also want to be conscientious of, especially with flexion of the elbow, flexion of the knee, of soft tissue approximation. So if you don't mind bending that knee one more time, soft tissue approximation, meaning that calf is going to approximate with that thigh, right? So you're going to take that into account when you're doing measurements. Likely this can be due to, if someone's really muscular, right? You might get a lower reading due to soft tissue due to soft tissue approximation. All right, thank you very much. So those are going to be our goniometer measurements for active range of motion. We have for the knee, the hip, the elbow, and the shoulder. So the next test we're going to go ahead and do is the YMCA sit and reach test. So what we want to do is we want the feet at about 12 inches apart approximately. Okay, it's about 12 inches apart. Perfect, just like that. And the heels, we're going to use our measuring tape. We're going to secure the tape down, the measuring tape with tape. So I'm going to go ahead. And you want the heels measured at about 15 inches. So go ahead, you're going to pull your toes up towards you. You're going to have them dorsiflex. Okay, you want that nice middle point right here. Okay, perfect. Oops, I'm going to go ahead and keep that right there if you don't mind. Thank you. Okay, that's perfect. We're going to measure 15 inches at our midpoint, right about here. So we've got 15 inches. Do you mind holding that for me? Thank you. That's perfect. We're going to go ahead and anchor this. Excuse my reach. Okay. We've got this at about 15 inches. You want to keep this nice and taut. You want to remove all the slack. Okay. Okay, we're going to go at about here. Okay, we're going to have ourselves do 2 attempts. So what I'm going to have you do is you're going to have your feet nice and together. Your hands nice and together, just like that. And what you're going to do with your knees straight is you're going to bend at the waist as far as you can down the tape. And we're going to take 2 measurements. Sometimes it's also the best of 3, but we're going to do 2 measurements here. So what you're going to do is you're going to take a nice deep breath in, and then you're going to exhale, and you're going to try to reach. Make sure that you're not bouncing. Once you get as far as you can get, go ahead and freeze. I'll take a measurement 1 time, and then we'll do it again. And also, YMCA test also allows for the best of 3. But in this case, per the instructions, we'll do 2 attempts. Okay? So whenever you're ready. Very good. Go ahead and return back to normal. Very good. So 16.5. And whenever you're ready again. Elbows nice and straight. And reaching. Okay, good. And hold. Very good. We got 18.5. So 18.5 is going to be the best of 2 attempts, or you can do a third with the best of 3 attempts. Perfect. Thank you very much. So that's the YMCA sit and reach test. All right. So the next exercise we're going to do is the ACSM push-up test. So we're going to have our female subjects, so we'll do a modified version of the test. We want to make sure they're going to have their knees on contact with the mat. We'll have the ankles dorsiflexed, and the starting position is you're going to be actually in a push-up position. So you'll place your hands here. You're going to want them shoulder width apart, directly underneath the shoulders, about shoulder width apart, right? You're going to want the back nice and flat, and what we're going to do is we're going to have them do as many repetitions. So what you want to do on the down motion is make contact with your chin with the mat, making sure that the back is straight and that the abdomen is clear of the mat. Okay, you want the knees nice and together and comfortable. And what we're going to do is we're going to see how many repetitions they can do without failure. So failure to perform 2 consecutive push-ups will equal failure, and that's what we're going to go ahead and document how many reps they got. All right, so are you ready? Okay, whenever you're ready. Chin touching the mat. Good. You're getting tired? Okay, perfect. So when they're met with failure, that's going to be what our final documentation is. So you got 20. That was great. All right? Perfect. So that's going to be the ACSM push-up test. All right? That's perfect. All right. So the next exercise we're going to go ahead and do is the ACSM curl-up test. So what we'll have our subject do is they're going to lay, once again, supine. So I'll have you lay flat on your back if you don't mind. Okay? They're under 45 years old, so we're going to go ahead and have our tape at 12 centimeters apart. Let's go ahead and keep this just forward if you don't mind. We want the knees flexed at about 90 degrees, about hip width apart if you don't mind. Perfect, nice and natural, about 90 degrees flexion. Perfect, and I want you to be able to reach for these. Can you reach those comfortably? If not, go ahead and scoot down as needed, okay? Perfect, just at the tip of the tape. Okay, let's bring you back just a little bit. Okay, go ahead and come back if you need to. That's perfect, okay? And so what we're gonna go ahead and do is we got a metronome set up at 40 beats per minute. So with the first click, you're gonna come up, and on the second click, you're gonna come back down. Make sure that you're breathing naturally and easily. You do not want them to invoke a Valsalva maneuver. This should be comfortable and that you're breathing naturally through the exercise. You're gonna maintain your cadence with the metronome. So we've gone ahead and we found a metronome on YouTube that we can use to kind of keep cadence. Okay, so fingertips here. So at that first click, you're gonna come up. On the second click, you're gonna come down.
How many in order for how long?
It's as long as you can go. Okay, once cadence is broken or they have failure to perform the exercise, that is when we'll stop the test. Okay, so I'm gonna go ahead and get started. Let me know, you feeling ready? Okay, so when I start that metronome, you hear that first click, you're gonna come up with it. Okay, and come down with the second click, and the third, and so on. Okay? And you're gonna wanna make sure you're reaching. Also, they need to be able to reach to that second tape. You wanna go ahead and see if you can reach that. All the way up, good. Okay? Very good. All right, here we go. When you hear that first click, you're gonna come up.
hands in touch with the mat. There you go, good. Keep those hands nice and smooth with the mat. That's it. Okay, very, very good. So we have 5, 10, 15, 20, 21. Did you get 32? All right. Not bad. So 32. That's going to be 32 on the curl up test, 80% curl up test. Let's go ahead and take your pulse and your blood pressure really quickly.
Okay, so following our muscular endurance test, we're going to go ahead and obtain their blood pressure and their pulse. I'm going to go ahead and roll this up again if that's okay. So we're going to obtain that blood pressure really quickly. Okay, excuse me. Making sure that balloon is flush with the anatomical landmarks over that brachial pulse, right? You've also got guides right here. Okay, we've got everything. We want to make sure we're getting a direct look on that meter. Have our ears forward. We're going to palpate that brachial pulse at the antecubital fossa. Okay. All right, nice and strong. Once we have it, place it nice and firmly. Make sure you're careful of the hosing. You don't want to pick up artifacts. Okay, all right. For this, we have 116 over 80. All right. Oops, I got something in my eye here. Okay. So 116 over 80. Okay. And then we're going to go ahead and palpate a radial pulse for 30 seconds. So I'm going to go ahead and take your radial pulse. You can rest that right there. Okay. Okay, so that's going to be 44, so marginally higher than earlier, and that's going to complete our assessment of all our muscular endurance, flexibility, and then baseline biometrics. Thank you very much.
Thank you.